there are 2 or 3 reasons why maybe, a lot more people are not taking up medicine as they would earlier. So it's very important for us to stop being doctors at all times. And, one of the things that I do try to do is to switch off the doctor switch once I leave the office.
Hi, good morning and welcome to the Checkup Tete-a-Tete. I am Dr. Sweta Sheth, psychiatrist based in Bangalore, and with me is Dr. Muralidharan Kesavan, Professor of Psychiatry at NIMHANS Bangalore. If you're a psychiatrist or if you've worked in the field of mental health in India, then my guest today needs no introduction. With me is Dr. Muralidharan Kesavan. He is the former Medical Superintendent of the National Institute of Mental Health and Neurosciences, or NIMHANS Bangalore. He is the current president of the Neuromodulation Society of India. He is a visiting faculty at several international universities, and he's currently a professor of psychiatry. Dr. Muralidharan, welcome to the checkup.
Thank you so much, Sweta.
So, let's focus on, let's have a look at how your journey has been so far in medicine. So, let me begin with a very simple question. What made you choose medicine? What made you choose psychiatry?
So the answer is very simple. I think the medicine and psychiatry chose me. Okay. So when you look back to about, say, 32 years ago, and that time we didn't have too many options in terms of careers. So, and a professional course was a very coveted kind of career option at that time, 93, 94. And so all of us took up the entrance exams for engineering and medicine, and I got a good rank in both. And then once you get a good rank in both, then the family starts kind of, gently gliding you or pushing you towards medicine. And it seemed like a good thing to do at that time. So I took, and I can say 32 years later that was a good choice.
I think this resonates with a lot of us.
Oh, yes. And so I joined medicine. That's how I joined medicine. And then after all that struggle of getting out of medical college, clearing your final year MBBS exams, and then the mandatory struggle to get a PG seat.
I write a struggle that we all resolved
very quick. So I've been writing so many entrance exams after I finished my, MBBS, that the first one that I actually got was MD Psychiatry at NIMHANS. So once I got the seat, then a lot of people told me that that's one of the best things that can happen to you. So like I said, medicine and psychiatry chose me, and I'm glad they did.
Yes, I think it was a marriage made in heaven. So tell us a little bit more about your days as a student, both in medicine and in psychiatry.
Okay. Yeah, so those were some of the best days of my life. So if I can go back to the summer of 94.
Okay.
And look back at how it all started in Bangalore Medical College. It was wonderful. Those 5 to 6 years. It became 6 years because we kept getting our exams postponed.
Are you sure it was only that?
Yeah. Like every time they'd announce exams, we'd all ask for a postponement.
You would ask for the postponement?
We would ask for the postponement, and then the exams would get postponed.
And the university would comply?
Of course. We were from Bangalore University.
Okay.
So the exams would keep getting postponed. So those 5 years were a lot of fun. It was, of course, the pre-gadget era. And a lot of things were like, you had to go to the library to borrow books. You had to meet friends in a particular place in the campus to know where your friends are. We'd spend a lot of time actually on the playground playing whatever was available in the college at that time. So it was like we were happy with what was there. And we spent a lot of time with each other's company, helping each other learn, helping each other through clinical postings, helping each other through whatever difficulties we had. So that was a wonderful period. It helped develop the strong bond with the people who studied with me, and we've become like it happens in all medical colleges. So we've developed a lot of good friendships over that period of time. I would also say that was a period where a lot of transition was happening, both in engineering and medicine. We were the batch during which the IT revolution started in Bangalore.
Okay.
We also started looking at technological advances entering the field of medicine. So we were, kind of fortunate to see how the old world system of medicine was and what kind of changes are likely to happen going forward. Like, for example, the first CT scanner came in when we were doing our MBBS.
Must have seemed very revolutionary.
Yes, at that time. Till then we were only doing X-rays, and then you had an ultrasound machine and CT scanner. So a lot of those technological advances.
And we take them completely for granted.
Now you don't do anything without those. So it was like, so we had the best of both worlds. We got to see very good clinicians and learn from them. And then we also got to see how technology can influence medicine.
Yeah, so that was an era where you relied more on clinical instinct rather than, rather than medical, investigations and blood tests and so on?
Sometimes only on clinical instinct. But I remember one of the things that we used to do for treating diabetic ketoacidosis, that sliding scale and all that, because getting a simple thing like a blood sugar test done was such a cumbersome task. Yes, so we got to learn from expert clinicians, and we also started learning got introduced to technological advances. So I guess we were one of those lucky batches which saw this transformation happen in the field of medicine. So to psychiatry, then onward to psychiatry, 2002, I got this opportunity to MD psychiatry at NIMHANS again. NIMHANS was already, a very, very reputed institution, and people would speak so highly of NIMHANS, and a lot of important things, policies were dictated by NIMHANS even then. So it was a wonderful opportunity to enter the portals of NIMHANS, and we had a small batch, a much smaller batch compared to the MBBS batches. And so again, it was a tremendous learning experience, a lot of fun, a lot of hard work. But
I think any great institute demands that of you.
Yes. But I think the environment was very different from the medical college environment. It was a lot more friendly, a lot more relaxed. And I think the whole atmosphere was more nurturing. And I think that has contributed a lot towards whatever career I made in psychiatry. I think those 3 years laid the foundation for what I was going to do later.
Okay. So, Dr. Murali, like you said, you finished your post-graduation at NIMHANS, then you did senior residency here, and then you stuck on as faculty and you've risen to the ranks and you're currently professor. But I have also seen you perform, a very major administrative role at NIMHANS. You've been the deputy medical superintendent and the medical superintendent. In pursuit of these administrative roles, you also did your MBA. So just tell me a little more about that. And for all the young doctors who are watching, what is the worth of an MBA to a clinician?
Thank you. That's a very important and interesting question. Yeah. So again, like the other things that happened, NIMHANS actually gave me the opportunity to serve as deputy MS.
That's very interesting.
Yeah. So so this came about because I wanted to pursue a degree, but that was not related to the field of medicine.
Okay.
Because we've studied so much of medicine that some other education I thought should be worth pursuing. And so one of the things that always interested me also, how a hospital is run and what is the patient experience, because we're only used to the clinical experiences.
I believe that's very true because we never see things from the patient side usually.
And we also don't know, there are so many other people involved with running a hospital, and we don't really appreciate or understand the kind of work and effort that they put in. So just to understand some of these things, I thought, okay, let me pursue an MBA. I'd seen some of my other senior colleagues from other institutions. They pursued, say, someone had done an MBA in finance, someone had done an MBA in human resource management.
Okay.
And that was helpful for them in managing their own systems or departments. And okay, let me pursue this. No knowledge is useless. Okay, come in handy someday. So that's how I enrolled for the MBA. And because I enrolled for the MBA, the then director felt that maybe I have an interest in administration. And then I got the opportunity to serve as deputy cleaners. So it was a unique opportunity where I was pursuing a course and also involved with the practical aspects of administration.
That must have given you a very unique
So fantastic. It was a fantastic learning experience. So not only was I understanding the theoretical constructs of a hospital administration, I was also getting to do many of those roles parallelly, like simple things like how to procure drugs, how are drugs stored, dispensed, what are the processes involved.
We generally don't give any thought to this at all. We just write a prescription and we give it to the patient and we're done.
Then sometimes they're upset if the drug is not available. Yes. So this actually gave me a lot of insight into. So that prepared me for taking up the bigger responsibility, which of course again was offered to me, and I'm very grateful for that. And it gave me an opportunity to serve as medical superintendent for 5 years. And that was a tremendous experience because many of the things that I had learned during my MBA and some of the things that I had seen as a deputy MS and felt were shortcomings which could be addressed, I actually got an opportunity to address those when I was MS. So as a clinician, if you can help about 20 or 30 patients a day, as a medical superintendent, I could help about 2,000 patients in a day.
Yeah, so you're shaping a hospital policy, making it more patient.
Yes. So you can scale up the amount of work you can do, the kind of help you can provide patients. So I think the MBA degree to help me to a great extent. And I was also able to inspire a couple of other people to take up MBAs.
That's wonderful.
So that we have a pool of people who are trained in hospital administration and who have the knowledge of hospital administration so that patients can continue to benefit from this. this whole exercise. So in that sense, that MBA was very, very helpful for me. I would strongly urge all students or practitioners to try and find some time. There are many things that people do. People do course in financial management now. People do a course in human resource management. So people do different kinds of courses. There are many courses that are available. Some of these come in very, very handy. I know a lot of people are pursuing MBA or MD in hospital administration now after doing MBBS. Because at the end of the day, when a clinician takes up an administrative course, the perspective that they bring is very, very different and very completely different from what a hardcore administrator would bring.
Yes.
And I think that can make a big difference in the patient experience in a hospital.
Yes, I think it should be doctors, shaping hospital policy rather than hardcore administrators or businessmen. I think that gives a more clinical and human touch as well.
Yes.
So, that's a really wonderful perspective. And I also personally know a lot of doctors now who after, medicine, after pursuing post-graduation are doing more things, like things like, finance or something. These are real world skills that we are not taught in med school, but then they come really in handy whether you're running a hospital or your own private practice. So I think this is, it's definitely something worth pursuing. So Dr. Murali, how do you balance it all? Which, between being an administrator and a clinician, which do you prefer more? And how do you balance all this with family? That is very crucial. That's something a lot of people struggle with.
The answer would be obvious that being a clinician is always something that anyone would prefer. But I really enjoyed the administrative role because I knew it was a time limited one. And this I was going to do for a short period of time.
So that you would be rid of that responsibility.
More than rid of it, I would say that I had a short period of time in which I could do whatever I wanted to do to make things better or put systems in place. So I really relished that opportunity for a short period of time, knowing fully well that during that period, my clinical work was going to take a bit of a back seat, but then there's always going to be a time in future when I'm going to come back to doing clinical work. And so it was like a small window appeared where I could do something more than what I was doing, and then I could go back to being a clinician. So yes, any day being a clinician is what is more appealing, but I did thoroughly enjoy my administrative role. And outside of work, I would say that again, working in NIMHANS or in a central government institution, it kind of gives some degree of time for oneself, because I think like most other institutions, we're not allowed to practice outside of work, and we're not allowed to do practice.
So that is both a blessing and a curse.
Yes, depending on how you want to see it. Yes, so it is both a blessing and a curse. A blessing for me because I get to spend a lot of time it's very with family and doing things that I would like to do, which I may not have been able to do had I been allowed to do, say, private practice. Of course, nobody will complain about the money, but so for things like, taking my son for, say, basketball class or a music class, it gives me the time to be able to do that, to be available if, to do some of the parenting work, to be at home and spend time with the family, to be able to attend programs, to be able to meet friends. So some of these things are there which do add, brings a lot of being in NIMHANS and being in a central government job. These things are possible. And one of the things that I do try to do is to switch off the doctor switch once I leave the office. It's very important for us to stop being the doctors at all times. And, we don't have to play the role at all times. And at home, it's important that we just put it aside. Of course, it's very difficult to do. A lot of friends and family will always reach out asking for help and those kind of things. But I think if you take it on a day-to-day basis, then there are always days when you need not have to do that. And you can just keep time for yourself and for your family. The most important thing, I think, is to have some me time. An hour or so in a day where you do what you want to do. Maybe read a book, maybe laze around, maybe watch something that you've been wanting to watch but didn't have the time to. And that's something that's very, very important. So at least an hour or so of me time is extremely important for all of us.
So that's a really great perspective, because I know a lot of doctors complain that they can't stop being doctors, Even when they leave the hospital, they are hounded with calls from the hospital, or, everybody is still trying to, ask them for advice or things like that. They don't get time to spend with family. They don't get time for themselves. So like you said, switching off is really important. I think you leave the white coat behind and step into the house as just another regular person, be a very involved parent, spend great quality, family time together. And like you said, it's it's having a central government job that has, given you that, that flexibility, right? So between a government job and private practice, pros and cons.
I wouldn't know because I've never had the opportunity to do private practice. So whatever I've seen is mostly vicarious experience, seeing my friends do. And so I think a government job in a central government institution gives you a lot of opportunities which very few places can offer. In terms of the academics, in terms of the clinical experience, in terms of the research expertise and the opportunities for research, as well as, in my instance, administrative experience. I mean, nobody can say that they have the experience of running a 1,000-bedded hospital, and that's very few people that can get that kind of experience. So being in an academic central government institution allows you that kind of opportunity. It allowed me to do fellowships in 2 different universities abroad. And we have so much of opportunities for academic, clinical, and research work. And I think that is something that cannot obtain.
Private practice can't offer that.
Yes, but I think if you do not have an interest in academics or say research, and they are not really a priority, let's face it. I think of the people who pass out of central government institutions, only about 10% of them continue to be in academic institutions. The remaining 90% go out into the real world and practice either in this country or abroad. And at the end of the day, if you think that clinical work is the thing that excites you the most, and research and academics don't appeal to you as much as they would do to some other people, then I think a private practice is an excellent option for people to do. Well, not only does it give opportunities for the practitioner to keep practicing the clinical skills and also make money in the process, it also results in the availability of more clinicians for patients. And we do know that there's a significant gap as far as mental health is concerned, and more private practitioners being available can actually help reduce the reactive rate extent and also make it available for patients who may not be comfortable coming to NIMHANS. I think private practice has its own charms, has its own advantages, and being in a central government academic institution has its own advantages. And it's about the goodness of fit. Where do you think you would work well? And I think if each one can decide that for themselves, then the world is a happy place.
Yeah, so private practice, and other hospitals, I think, do fill a healthcare gap that is, very that's very yawning and very stark in our country. That's it. Okay. So, Dr. Murli, you've told us about your journey through medical school, through post-graduation, and it sounds like quite a charmed journey. And you also, you are also very happy and satisfied at being a doctor. But currently we are seeing this growing trend where, the medical profession is probably, I can say, falling out of favor. There was this recent newspaper headline which said that over 90% of doctors don't want their children pursuing medicine. So what's your take on this? Okay.
So that's a very interesting question. And interestingly, that's one of the first advice that I got from a senior professional when I took up medicine 30 years ago. I said, don't join medicine. It's too much of a struggle. And, you're going to spend most of the best years of your life just studying, and, why don't you take something else?
Okay, so you're saying the disillusionment is that old?
Not disillusionment, but that kind of advice has been there from the time I joined medicine. So we've had a group of people telling us. So I guess it's a reflection of someone's own personal struggles during their journey pursuing medicine. And the advice is usually given in good faith, hoping that the other person does not have to go through the same thing. But if you were to look at it from a very objective perspective, then I would say that there are 2 or 3 reasons why maybe, a lot more people are not taking up medicine as they would earlier. So one of those would be that there are far more career options these days than what were available, say, 20 years ago. There's so much of new job opportunities that have come up. There are so many things that people can do. I mean, we never knew that there's something called a YouTube influencer, and that itself can be a career option for people.
I don't know if that's so great.
People are doing it, right? So I'm saying that there's so much of out of the box thinking and so much of new job opportunities that are there that people find more things to do apart from just pursuing, say, engineering or medicine.
So all the conventional
career options no longer appear to be as catchy or relevant, but they still remain career options.
Yes.
The other thing I think is financial security. And that is something that is probably not linked to the profession that you're pursuing. Because even if you're, say, working as, and in any job, I don't want to name jobs, but let's say doctors and you, a lot of them are also learning how to plan their financial security, how to invest, So there are other ways in which people are strengthening their financial security, and the profession is not the only way of staying financially secure, unlike earlier. So I think that could be another reason why they are opting to choose professions which they are more passionate about rather than going with the conventional.
So no more of profession choosing you. You very deliberately and intentionally choose what
choose professions.
Okay.
And of course, the point that a lot of doctors don't want their kids to take up medicine, I guess, again, it's a reflection of the hardships and struggles that they may have faced, and they probably don't wish their child to face the same hardships. But two, I think in terms of the number of people who shine in their professions, who become very successful, that would be probably about 5 or 10% of the number of people practicing medicine, irrespective to average PTT. So if the opportunity to really rise and shine is not there, and it is not probably as appealing as, say, let's say 40 or 50 years ago, the doctors were very revered, and then you would get a lot of respect, and you could walk into any place and you'd be treated as a VIP. But things are not the same now.
Today, doctors are more equal.
So I think maybe that appeal is not there. So it could be one of these many reasons. But I think, having gone through the struggle themselves, they probably don't want the offspring to go through the same thing, while there are so many other career options available. So that would be my way of looking at it.
So is medicine still relevant as a profession?
Yes, it is. Like I said, 50 years ago, I got the advice, don't try medicine. People are still giving the advice, and we're still having a lot of people opting for medicine as a career choice. So medicine will always be there as a career choice, and people will continue to shine in medicine.
Yeah, so that's a very interesting point you've made, that medicine will never die out truly. As long as people fall sick, as long as people need healing, they will definitely turn to doctors. Having said that, Dr. Murali, how do you think that the medical profession should evolve to keep up with current trends, especially now, with the growing use of artificial intelligence in all domains of life? Many doctors view AI as a threat. What is your take on this?
Thank you so much for asking that question. I think we have all been using AI in some form or the other, at least in the last.
We won't admit it though.
We won't admit it. But I think what we're really worried about is a super intelligent AI that we think will take over our roles and our profession. But I think, like we were discussing some time back, a medical record, which was a paper and pencil record, has become completely digital. And that gives us so much more information now.
Yes.
So the AI has allowed us to do that. So I think the AI will continue to be there. It will continue to assist medicine. Like simple thing like reading an MRI image is something that is so useful for a clinician, especially where if you're practicing in an area where access to a radiologist may not be easily available. So we have created this so that it can make clinicians' lives easier, and we have continued to use it. And I'm sure going forward, all of us will use AI in some form or the other to help us in better decision making, to help us in better treatment planning, and probably to improve outcomes for patients. What we are also worried about is the super intelligent AI who will replace, say, 20 years of clinical experience and become the doctor that took us 20, 30 years to be.
That seems very unfair.
Yes. So on the face of it, seems very unfair, but that is an extremely super intelligent AI that we are talking about. And, while the AI also has to evolve while we are evolving. And to do that kind of work, I think an amount of data that needs to be available is enormous. And I don't think so much of data is available as of now. Maybe going forward, they may have it. I don't know. But then I think as of now, with the kind of data that is actually available to develop that kind of super intelligent AI, maybe a little difficult, but I may be wrong. But as of now, to me, it appears like AI would be a useful adjunct that can help clinicians make better diagnosis and prescribe better treatments.
So you're saying that AI will help bridge the gap in healthcare that this country faces currently?
We are hoping that would do that without reducing the role that the doctor has to play. I think that's the worry that everybody has.
Yeah. So personally, I see a lot of people using AI, say, to transcribe notes or to, generate prescriptions or to check for drug interactions. So from that perspective, I think it is I think it's a good use of AI in that sense. That's it. Yeah. So, Dr. Murali, thanks for this really wonderful interview. Before we wind up, just a couple of more questions. What is the best advice that you have ever received?
I don't think I can use the exact words, but the advice was, go join NIMHANS.
In what sense?
So after I got this, cleared the entrance exam, and then there was another exam that I also cleared at the same time. And So there was this a little bit of a dilemma. Should I take up psychiatry or should I take up some other profession? So one of my friends advised me in unparliamentary language to go and join NIMHANS. And I think that's the best piece of advice I got.
Yes, I think it has benefited the institution also tremendously.
And it benefited me tremendously.
And what advice would you give to all, to all the young doctors who are viewing this?
So I would say make the most of your time and enjoy what you're doing. Because I think time management is something that we are not very, very good at. And I think if we manage time adequately, then our lives would be a lot more peaceful and productive. And so time management, so learn to manage your time well. And if you're a medical student, then make the most of your time wherever you are. I mean, if you're doing a post-graduation, you know that you have a very limited time in that institution. So try and make the most of what that institution has to offer. Try and make the most of what the teachers have to offer. Try and extract the maximum possible knowledge out of that institution. It may look like hard work and it may appear painful at times, but then remember that your time in that place is very limited. And the minute you cease being a student there, then all those access to all those facilities kind of shut down. So make the most of your time in your institution and learn to manage your time. Those were the two things.
That's really wonderful advice. And once again, Dr. Moody, I would like to thank you for your time and for giving us this interview and for speaking to the Checkup magazine. Thank you.
Thank you. Thank you so much.